Hi, my name is Katie Stillwell. I'm a foodborne disease epidemiologist with the South Carolina Department of Health and Environmental Control. I've worked at DHEC for a little over 3 years. I started here as an inspector in restaurants, schools, various cafeterias. I left the agency, I went back to school, then I worked for the Virginia Department of Health in their food protection, rabies, and onset wastewater program. And now I'm back here at DHEC investigating foodborne outbreaks. Approximately 1 in 6 people become the victim of foodborne illness each year in the United States, so I'm sure that some of you have experience with this firsthand. It's a very widespread problem, and a lot of it boils down to proper hand washing. There's more data to suggest that food handlers cause up to 50% of foodborne outbreaks. So as part of the food protection program, we have inspectors all over the state, and their primary goal is to go out and to inspect these restaurants. They're looking for major risk factors that are known to cause illness. Hand washing is a big one, proper cooking temperatures, proper food handling, proper food storage, approved sources of various foods. Those are all important. And so that's what we focus on, rather than general cleanliness, dustiness. That's very important, but we are focusing specifically on the things that we know to cause serious illness. I wanted to give you an example of a recent foodborne outbreak that I worked on, as well as a team of many other people here at DHEC. We received some reports from a doctor's office that several of their residents of a nearby community had come down with diarrheal illness. And the illness seemed to be prolonged. Several of them had been on antibiotic therapy and were still having chronic diarrhea. And so we began investigating. Our first step was to look at the water source and see if there had been any contamination or breaks in the water line. We worked with the county water supply for that. We looked at all of their records, and we found no fecal coliforms in the reports, meaning that there likely wasn't any kind of a breach in the water system. So then we started to scratch our heads a little bit. The next thing we did was to request stool specimens from some of these residents of the community that had been ill. We sent them to DHEC's Bureau of Laboratories, where they were tested for a number of viral, bacterial pathogens, as well as ova and parasites. Out of all the tests that were done at the lab, nothing came back positive. So we still had no idea what was making these people sick. Eventually, we contacted the CDC and found out that they could test for some additional parasites, which we did not have the capability to test for at our lab. So when we sent the specimens, it came back that these residents of this community were suffering from a parasite called Cyclospora. It's something that you normally see in developing countries. You don't usually see it in the United States. So it was sort of a rarity, and we weren't really thinking of that. But we were able to work with the CDC, and then after that, we tried to trace a food source. That involved multiple interviews with the ill persons. We inspected some of the local restaurants in the area. We looked at their invoices to see if they had received any products from other countries. And at the end of the day, we weren't able to trace it to a source. However, we did find out what these people were experiencing, and they were able to get the proper antibiotic treatment to make themselves better. So we consider that a success. For a little bit of a transition from the story I just told, luckily a lot of times we are able to solve the source of an outbreak. There was one instance a little over a year ago on which I was working. A large group of elementary school children became sick after a cafeteria lunch. And when we investigated, we found out that that day they were served their special Thanksgiving meal prior to the Thanksgiving holidays. It was on a Monday, and Thanksgiving was on the following Thursday. The interesting thing about that investigation was that other students were served from that same cafeteria, but there was only a small group of children that became ill. And so upon some risk-based assessments at the facility and talking with employees and talking with parents, we were able to collect some food specimens. We were also able to collect specimens from a child who had become ill. And when we tested those, the lab detected Staphylococcus aureus, which is a bacterial toxin. It usually causes a person to become ill pretty quickly after eating the food, and then it quickly leaves the body. So we found out what it was, and now we needed to find out what happened. Well, apparently there was a large central kitchen that was making food and then sending it out to various schools in the school district. They were using coolers to transport the food from one school to another, and there were some problems in the process. Temperatures weren't taken, and there were definitely, there was some room for error. And so it appears to just been that one pan that went to that one school that was affected, and that's why only that group of children became ill. So that was great for us that we were able to solve it and that all the kids were okay. But just as a note, I wanted to remind you that if you ever think you have foodborne illness, please let us know. You can report it on our website, and it really helps us to solve outbreaks. Thank you.